is one of the first exercises that we're going to do to start progressing you with your diastasis recti and rebuilding that core strength. So you can have a bolster if you want, not necessary, but we are going to be laying down. So get on the floor or some other hard-ish surface. I think on your bed it can be a little too soft to feel what we're trying to feel, okay? So bolster is optional. I've got it here, just so you know that you can have one, or a couple pillows there. So let's bring hands down to your belly, okay? So we've talked about the number of fingers your gap is, the number of millimeters, and how that equates to your fingers. And if you're not one of my patients, become one of my patients and we'll figure that out so you can get better at this and know what you need to do to get where you want to be. But so bring your fingers and recall the core breath. When you inhale, using your diaphragm, and then when you exhale, you're going to engage your pelvic floor, and then you're going to also engage your transverse abdominis, drawing the muscles together across your low belly, and then relax. So inhale using that diaphragm. Exhale, pelvic floor turns on, coming up to your navel. Your transverse abdominis engages, pulling together across that low belly. Excuse me. And take your hands to your belly so that you can feel what's happening underneath your fingertips. Inhale. Exhale, engage pelvic floor, draw transverse abdominis together from hip to hip. It meets in the middle, and feel your abdominal muscles, that rectus abdominis. Feel the borders of it right along the sides of your navel. Inhale, relax. Exhale, engage that pelvic floor, draw it in and up. Draw the transverse abdominis together from side to side. And you're going to feel your ab muscles pop just a little bit into your hands. Okay, so we know where that is. So now what I want you to do, girlfriend, we are going to hold this contraction, of that pelvic floor and of that transverse abdominis. And you're also going to think about being nice and strong from ribs to hips in a straight line, because your rectus abdominis runs in that straight vertical line. And now with your exhale, you're going to lift that head up just a little bit. Inhale, lower. Keep that squeeze. Exhale, lift your head. Inhale, lower, and relax. So you felt your abdominal muscles nice and tight during that, right? You probably felt that they wanted to come together just a hair. It's really subtle, but it's very unlikely that they wanted to separate. If they did, your starting point is that you have a pillow under your head, and then so you're lifting your head even less, okay? All right, so we're gonna start again. We did 2 just now. Now we're gonna do 4 head lifts, all right? Inhale. Exhale, engage that pelvic floor, drawing it in and up. Draw the get together across the hip bones. And now add that contraction from ribs down to hips. And lift the head for 4. Lower it down on your inhale, maintaining that activation. Lift 3. Keep that activation. You're doing awesome. Lift 2. Lower it down, breathing in. And last one, exhaling as you lift. And then lower it down, release. All right, well done. So you know where we're going next. We're gonna lift and for 6 different breaths, okay? Or six breaths total, not 6 different breaths. All right, inhale to that diaphragm. Exhale, draw the pelvic floor together and up. Draw the hip bones together, draw the ribs to the hips. None of them changing position, of course. And then exhale, lift up 6, lower down. Exhale, lift up 5, lower down. Exhale, lift up 4, lower down. Exhale, lift up 3, lower down. Exhale, lift up 2, lower down. Exhale, lift up 1, lower down. Awesome. Awesome. So far you've done 12 of these little baby crunches. And I want you to realize, you'll notice that when you lift your head, this really is the foundation of a sit-up. So I really think that with commitment and being patient with your body, you are going to go so far and get to your core goals. You just need to honor your body as you go and look at everything as foundational and as a stepping stone. See the importance in the little steps that are going to get you to that big leap. Okay, so we've done 12 of these total. Now we're going to do 8 in a row, okay? Of course, if you have any pain at any time, I want you to stop. But you know also what it feels like for your muscles to work a little bit. And that working feeling, that is okay. All right, here we go. We're going for 8. So take a nice deep breath in with that diaphragm. Beautiful. And then exhale. Squeeze first from the pelvic floor, drawing it in firmly. Draw the hip bones toward one another with that transverse abdominis. And then think about pulling the ribs down to your hips. Nothing changes position. You're just activating in this solid shape. All right. Exhale, lifting up for 8. Inhale with your lower. Exhale, 7. Inhale with your lower. Exhale, 6. Inhale, lower. Feel those abdominal muscles. If you feel them coming apart, I want you to lift just a little bit less. All right, we got 4 more. 4, 3, keep this squeeze. I know it's hard. 2, and 1. All right, great job, ladies. Try to do this at least once a day. But even if you're only doing it 3 times a week, you're so much better than if you were doing it 1 time a week. And if you're doing it 1 time a week, that's better than doing it 0 times a week. So no matter what, if you're doing this at least once a week, you are working toward your goals. And I salute you. Okay, have a great day.